It's a different system.
Yeah, and of course, I mean, I assume we still want to optimise vitamin D and things like that.
Absolutely. There's no single answer. Vitamin D has had enormous amount of work done in recent years, really. You and I, John, can remember that if you don't have enough vitamin D, you get rickets or osteomalacia if you're an adult, and that's long gone.
Well, it's still there, but there's a few things added to it. Excellent video, by the way, by Dr. David Grimes on this very channel just the other week. Do watch it. It's fantastic. Sorry, this is the last question. I've just thought of it. Is there a role for hydroxychloroquine and zinc in long COVID? Because I'm just thinking if the spike protein is being produced in the cell, you get more zinc into the cell. We know that zinc is antiviral. Hydroxychloroquine will gate the zinc into the cell. Is there a possible role for those two in combination?
I don't know the answer. I can tell you what I've done. There may be in post-viral long COVID because these people presumably have replication of the virus. Whether that has any role in the post-vaccine variant of long COVID, I don't know. When I started some months ago getting a number of these patients, I started treating them with both hydroxychloroquine and ivermectin. But around that time the ivermectin blocking story came out, and it was very persuasive. And so what I've now done is basically stopped the hydroxychloroquine and stuck with the single ivermectin. So I don't know the answer. I understand the logic, there's a great project for someone to do.
Oh, there's PhDs and MDs flying out of this video, but by the dozen, Robert. I agree with you completely. To study one variable at a time, i.e., the ivermectin, is much more straightforward than having several variables all going at the same time.
I agree. And when I started seeing, it breaks your heart to see these patients saying, I just can't cope because a lot of other things I do. But
we need all the doctors and nurse practitioners and all the people around the world to step up to the plate here, don't we, and start treating.
These patients are very, very smart people, and they follow the story. They follow your channel. They follow the story. One patient who I'm sure will be watching, and he or she won't be mind me. Had such problem, they decided that ivermectin would be a thing to treat, and you can get the cream quite easily for rosacea, which is
transdermal, yeah.
And they worked out how much cream to put on to get a certain dose, which actually turned out to be a pretty similar dose to what I'm giving by mouth. And this person had been to hospitals, had been in hospital. She had terrible neuropathies, and she now copes quite well. And won't use anything but her cream because she's quite convinced it works. Now, I'm not suggesting this is the way to go in any way, but I'm just saying that patients are smart, and they're smart. I always tell my patients they're smarter than I am, and I mean it.
She's worked out how to individualise and optimise her own personal care. That's wonderful.
Absolutely, because the doctors had not come up with anything that was helping.
Yep. So if you have had similar experiences, do let us know in the comments, because Robert and I were talking about this. The comments are really important because they are a form of qualitative research. But we really do need nurses and doctors and pharmacists around the world to step up to the plate and realise that we have postulated the hypothesis that this is a treatable condition.
I'll just say two things about that.
Please.
We live in a different world. The technologies are changing. The randomised controlled trial has been pushed back as something that is very expensive, done by big pharma companies to register. Great things, but they have defects, as we well know. John and I were talking about, well, wait a second, look at the data that's coming forward. I had a quick look through some of the comments of our last talk, and I was blown away by the number of people who are having similar problems. We think that something's pretty rare because we see 2 or 3 cases, but then you see people, well, the bottom line was they don't see it because they weren't doing anything to help these patients. And if you talk to the general practitioners, they say, I've got lots of these patients because there's been nothing to help them. And so they're appearing in great numbers in clinics, potentially like mine, although I see very few patients these days.
Yep. But the message is, take this information to your own doctor and optimise the care with your own doctor. And now in Australia, for example, where ivermectin is allowed to be prescribed,
yes,
I would be hopeful. And the situation in the States is probably more promising depending on the states. The situation in the UK, doctors are still, I don't think I think you'll be struggling to find a doctor to prescribe ivermectin in the UK. But the point is, this has to change because we need to help our patients.
Are you saying, John, that in the UK it's legal, but the doctor's been so narrative brainwashed?
Yeah, lots and lots of people have told me that they've asked their doctor to prescribe ivermectin,
and
the doctors have refused.
And the same will occur in this country.
Yeah, which is just You know, if there's very little risk and there's a potential massive benefit, risk-benefit analysis, you know, to me it's basic stuff. But it's a hypothesis. If it's tested and it's substantiated in multiple instances, then the authorities can only deny the truth for so long. Eventually, the same as they did with Helicobacter, the same as they did with tobacco, the same as they did with asbestos, the same as they did with the infected blood scandal, the same as they did with the post office workers in my country, eventually they're going to have to admit it.
Yeah.
And patients will be helped. And we're really sorry about the delay.
Well, thanks very much, John. I think what I'm sure your viewers appreciate is that you're providing it's fascinating, a sort of new platform for asking questions, and the idea of evidence-based communication, which is what your programs are based on.
But what amazes me is that the leading doctors in the world choose to come and talk to me. I just find it humbling and fantastic. Genuinely, it's amazing. So.
Well, I can tell you why. It's very simple. You're the only medium that bases everything you do on evidence.
Yeah.
And that's the difference.
Yeah, thank you for that, Robert. Yeah, that's good. We will keep trying to do that. But for now, Professor Clancy, as always, amazing insights. Thank you very much for coming on.
Great pleasure.